I chose to do my project over Mexico's healthcare versus the United States healthcare because Mexico is so culturally different than us, and I wondered if their healthcare would follow in that. As for basic demographic information, Mexico is closer to the US in statistics than I thought. They have a total population of around 129,163,267 people compared to the United States 325,398,017 people. That's a little over a third of our population. They spend about 3.3% of their GDP on healthcare, which is low compared to the United States' 8.3%. Their healthcare per capita is significantly lower than ours, averaging at $677 compared to the US spending of $9,403. They have more active physicians than I was expecting. There are around 1.5 physicians per 1,000 people. In the United States, there's about 2.3 physicians per 1,000 people. Their obesity rate is almost as high as ours at about 24.2%. The United States average is around 30.6%, so their percentage is pretty close, but this is probably due to their culture. Finally, their smoking rate averages around 10.2%, which is actually lower than I was expecting, especially with all the tobacco products that come out of Mexico. The US has a 15.1 smoking rate, but this has started to go down recently. Here is a brief history of Mexico's healthcare. In 2012, they instituted universal healthcare. This is a healthcare system that provides healthcare and financial protection to all citizens. The United States has not implemented this into their system yet, so they are ahead of us in that area. Their hospitals were originally established mostly by the Catholic Church. One of the oldest and largest hospitals in Latin America, known as Hospicio Cabañas, was founded here in 1791. It is currently still active and now serves as a World Heritage Site. The Mexican healthcare program known as Instituto Mexicano del Seguro Social was founded in 1943 while President Manuel Avila Camacho was in office. It was founded to establish the legal precepts in the Article 123 of the Constitution. This is the largest social institution in Latin America. Public healthcare is accomplished through the provision and delivery of the federal government of Mexico. Therefore, the government plays a big part within their healthcare system. It is subsidized by the federal government depending on the person's employment status. All citizens are eligible for subsidized health care regardless of status under the Federal Secretariat of Health Agency. This is offered to those who are unemployed. Secretariat of Health is the largest public healthcare institution. It has about 809 hospitals throughout the country. Most public hospitals rely on a network of small hospitals. Over 50% of public hospitals have less than 50 beds. Seguro Popular is a public health insurance that covers a wide range of services without co-pays for its affiliates. The aim of Seguro Popular is to ensure that even the poorest citizens have access to treatment for a range of preventive health care services such as vaccinations and diabetes screening, as well as treatment for chronic and catastrophic illnesses. Public health care in the United States is also referred to as government insurance. Medicaid is a state-run government insurance program that helps some people with lower incomes pay for their medical care. Medicaid pays your health care provider. A person may have to pay a small amount for a certain medical care. It is available to only certain low-income individuals or families that are eligible. Medicare is health insurance provided by the government for people who are 65 years of age or older. People with certain disabilities or chronic disorders may be eligible. This insurance covers some but not all medical costs. There are 4 parts: Part A, Part B, Part C, and Part D. Part A is hospital insurance. This helps cover an individual's care in certain medical facilities. Part B is medical insurance. This pays for doctors in certain outpatient areas. It also covers some of Part A, like for healthcare and physical therapy. Part C, the Medicare Advantage plan, allows a person to get health coverage for all of Part A, B, and D through a private plan. Part D helps cover some of a person's prescription medicine costs. This part is good for people with limited incomes because it will help with their prescription costs overall. Private healthcare in Mexico is delivered through a free market system. It is only available to those who can afford it. This is the same for private physicians at an office or clinic. Less than 10% of the Mexican population have private insurance coverage. However, private hospitals are 2/3 of all hospitals in Mexico. I find this interesting because more people cannot afford them and prefer to go to public hospitals instead. Employed citizens use the program administered and operated by the Instituto Mexicano del Seguro Social, also known as IMSS. This is provided by the employee, private employer, federal government, and general taxes. There are about 279 IMSS hospitals in the country. Others are serviced through the Instituto de Seguridad y Servicios de los Trabajadores del Estado, also known as the ISSSTE. This attends to the health and social care needs of government employees, local, state, and federal. There are about 115 ISSSTE hospitals in the country. The state government also provides private health services independently to those that are provided by the federal government programs. Private health care insurance is often offered through employers or other organizations. Some employers offer only one type of insurance plan, while others may allow you to choose from more than one plan. Buying private health insurance on your own would be more expensive because you pay for everything by yourself without an employer's help. Some insurance plans work with healthcare providers to provide care at lower costs, which is called managed care. There are different types of managed care plans. Health maintenance organizations usually pay for only medical care within their network of healthcare providers. These usually cost less than a plan that offers more providers. Preferred provider organizations cover more of a person's medical costs if that person gets within a network of care providers. But they still pay some costs for care outside of the network. With point of service, a person can choose between an HMO or a PPO each time they seek medical care, which offers more flexibility. Indemnity plans are different from managed care plans. The choice of doctors or hospitals is not restricted. A person's healthcare providers paid a fee each time they get medical care covered by their plan. The out-of-pocket costs could be greater than a managed care plan. We know for a fact because of the American Recovery and Reinvestment Act, all public and private providers are required to use electronic medical records. They are also mandatory in Mexico, but only for public hospitals. However, only the physicians have access to the data. The data is collected by nurses, then given to clerks to insert into the system. Here are a few more random facts about Mexico's healthcare system. The procedures are 1/3 of the United States price. The care is mainly paid out of pocket or through Seguro Popular. Overall, their health insurance costs much less than in the United States. Preventive services are covered through health care, or they can pay for them out of pocket. Limits on out-of-pocket payments are unknown or non-existing. The head of the household or the individual is responsible for paying for theirs or their family's health care insurance. An average visit with the doctor costs around $30 to $43. Here are some random facts about the United States healthcare system. The average payment for a doctor's visit is around $49 if they're privately insured, but if they do not have insurance, it is around $160. Most healthcare plans cover preventive services. The individual or head of household pays for insurance, but if they have private insurance, then their employer normally pays for some or all of it. There is a known limit on out-of-pocket payments. It is $7,150 for an individual and $14,300 for a family. In conclusion, their healthcare varies quite a bit. Mexico's overall cost for healthcare is less than the United States. They both, however, provide both public and private healthcare insurance. Government plays a heavy role in both of their healthcare systems. Mexico has universal healthcare coverage, while the United States has not provided that to their population yet. Overall, Mexico provides a stable healthcare system for their population. It has its ups and downs, but what healthcare system doesn't? Thank you so much for listening, and I hope you learn more about healthcare within Mexico, along with how their system differentiates for the United States'.